Okay.
Good morning, everyone. On behalf of Secretary Joy Strickland, I would like to welcome you all to the Louisiana Department of Veterans Affairs 3rd Annual Suicide Prevention Summit. I am Larry Williams, and I work as the Veterans Outreach Program Manager here at the LDVA. This year for the summit, we really wanted to focus on what do we know and how can we apply it. We all understand that one suicide is one too many. We've reviewed the numbers, we know the percentages, but a lot of times we may ask ourselves, how can I help? You know, what can I do personally to stamp out or help fight suicide? And that's what this summit is focused on, is helping us all become better advocates for suicide prevention. So we really wanted to focus on, you know, not just the numbers, but also what are tangible things that we can immediately employ in our own community, in our own personal lives, that we can help ourselves become better advocates for suicide prevention. And that was our main focus, and that's what we really will look at during this summit. An admin note, there is a Q&A box. If you have a question, you can post it in the Q&A box, and we will get it answered at the end of the summit. With that being said, I'd like to introduce our panel of speakers. And I will read this right off the sheet because I do not want to mess it up. A very talented lineup of hardworking individuals, and I'm so glad that they agreed to be a part of this summit. I want to start with Aimee Johnson. She's a licensed clinical social worker and program analyst with the U.S. Department of Veterans Affairs in the Veterans Health Administration's Office of Mental Health and Suicide Prevention. Don Schiro is a licensed clinical social worker, board-approved clinical supervisor, and holds a Master of Social Work degree. She is a U.S. Department of Veterans Affairs Suicide Prevention Case Manager with the Southeast Louisiana Veterans Healthcare Network. Dr. Gayla True is an investigator for the U.S. Department of Veterans Affairs South Central Mental Illness Research, Education, and Clinical Center with the Southeast Louisiana Veterans Healthcare System. And Mr. Matt Bailey is a veteran champion and vision team member with the Southeast Louisiana Veterans Healthcare System at the U.S. Department of Veterans Affairs. And before I pass it on to our first speaker, Aimee has put the link in the Q&A. We will get it posted, but we'd like to remind everyone that the Veterans Crisis Line is available. If you or someone you know is having thoughts of suicide, contact the Veterans Crisis Line to receive free confidential support and crisis intervention. This is 24/7, 24 hours a day, 7 days a week, 365 days a year. The phone number is 1-800-273-8255 and press 1, or you can text 838-255 or chat online at veteranscrisisline.net/chat. And without further ado, I'll turn the summit over to Aimee Johnson. Aimee.
Thank you, Larry, and good morning, everyone. Can someone just confirm that you can see my screen, please?
We can, it looks perfect.
Okay, great. Thanks again for joining us, and we're excited to talk with you today. And in light of this being Suicide Prevention Month, like Larry said, we would like to cover some data, like about some of the concerns that we have specifically about what we call lethal means safety. Lethal means references the way in which somebody engages in self-harmful behavior or suicide. And we'd like to give you a number of resources. So I'm going to get us started, and then I'll turn it over to my colleague who will take us into an intervention that can be used to help people. And I'll start off with some overview of data. I'd also like to point out, since we're talking about a heavy subject, and thanks, Larry, for talking about the Veterans Crisis Line, that those of us that do this work have no doubt been impacted by the tragedy of suicide, and whether it's our personal lives or our professional lives or both. But we also also have a lot of hope. And the reason for that is that we see people get better. We know what it's like to stand with someone who is going through a crisis, who's at the worst place they've ever been, and then be able to see them walk through that. With resources, with help, with treatment. We know that treatment works and recovery is possible. So we want you to help us spread hope. I'd also like to point out that suicide is a national public health problem. This is not a unique problem that veterans face. This is actually a public health problem that does not discriminate. It affects all of us. And what we've done here is just summarize some data for you. The data that we have here is from the year 2017. And our most recent VA suicide data report is also from that year. On an annual basis, the VA does publicly share data just like the CDC does. And hopefully you'll see here that we have a lot more work to do and we need your help. Some key data points from the VA's annual suicide data report from the year 2017 are here in the infographic. And at least for me, they're a little bit easier to understand when I see them in this format. But they're incredibly concerning. So we think that we can change these numbers, especially with the good work that you all are doing and throughout the state of Louisiana and wherever else you're joining us from today. I'd like to call out a couple key points here, especially the box on the bottom. So here we're talking about lethal means safety. We know that in the year 2017, almost 70%, so over 69% of all veteran suicide deaths resulted from a firearm. That gives us information for what we can do to try to inform people of how they can increase their safety in their home environment. And we'll talk more about that in a short time. We also know that, for example, male veterans in the age range of 18 to 34 have the highest rate of suicide in that year. And that overall, the largest number of suicides we saw in male veterans ages 55 and older for that year. In the top left box, female veterans are 2.2 times higher than their non-veteran female counterparts. After accounting for differences in age, they're that much higher at risk for suicide. We also know that the increased rate of suicide among male veterans is higher than their non-veteran counterparts. But we know also that suicide is complicated, and I think this is sometimes hard for us to relay. So if you've ever known someone who's been in a crisis, it can feel sometimes like that crisis is being done at us if you're in a relationship with someone. It can be really hard to watch somebody go through such a tough crisis. But what I can tell you is that it's more complicated than that. It's not a single cause. We know that there's a lot of risk factors that any of us can have, but there's also a lot of preventative factors. And so hopefully what you'll walk away with today is that there's things that you can do both in your own personal life and in your professional life and in your community to help increase protective factors for veterans. One of the reasons why I say that we need your help is that we know that in the year 2017, of those veterans who died by suicide, the majority of them were not coming to the VA for their health care. Here, VHA references the Veterans Health Administration. That, of course, is the agency that myself and others here today represent, and it's part of the broader VA. And so at the bottom of this screen, you'll see something that I think is pretty compelling to those of you in the community. Among the veterans who died by suicide in that year, about 6 had had an encounter with the health administration in 2016 or 2017, so the year before they died or the year they died, while 11 of them had not. And so you may have heard something about our daily numbers. And I think a lot of people have seen organizations that say, 22 kill, or, these organizations that try to bring attention to the number, which is tragic, of how many people died by suicide, and it is tragic. But we also need to think outside of that, that we at VA need your help to reach these folks, because we know that they're in communities. We know that veterans are everywhere, that they're very active, and that if we can do more to message, to reach out, to increase connectedness, we could save more lives. Since we are talking about lethal means and the role that firearms play, we wanted to share this slide with you as well. Again, it highlights at the bottom there that in 2017, over 69% of those suicides were by firearm. These are the other comparisons that you have here, which is comparing veterans to their non-veteran counterparts with the method or the mechanism by which somebody hurts themselves. One of the other areas that gives us a lot of hope at the VA is the important research that's done here, and the references are here, to tell us that people who survive suicidal crises really we've learned a lot from. And what that means is we know that crises are typically short. Most suicidal crises are in a matter of minutes. They're over or within an hour. And if you've ever worked with someone in a crisis or you've been in one yourself, you know that those thoughts can come really fast and really hard, and they're incredibly difficult. They can also be gone. And so what we know is that if somebody is in a suicidal crisis and they have thoughts of hurting themselves, if they reach for something that's incredibly lethal, like you see on the right side of the screen, a firearm is incredibly lethal, especially if someone knows how to use it. And they don't, suicide attempters who've lived through their crisis have taught us all a lot about the fact that they don't really want to die. They want the pain that they're experiencing, the physical, the emotional, the mental pain to end. And most of the time, they immediately regret the decision. Well, if you use a firearm, there's no time for you to, usually, there's no time for you to regret that decision. Although a few folks have miraculous stories of recovery from a firearm injury, most people will not live to be able to seek that help. Compared to other methods or other lethal means, for example, medication. Most women who never served in the military, if they're in a suicidal crisis, will overdose on medication. And after an overdose, they don't immediately die. They can reach out, they can call for help, they can get the treatment they need, and they can go on to live and improve their situation. Lethal means safety works because about 90% of people who survive a suicide attempt don't go on to die by suicide. I think that's a really important point that's oftentimes missed. So again, if somebody makes it through a suicidal crisis, the vast majority of the time, they will not go on to die by suicide. So if we can reach people ahead of time and help them through their crisis, we know that there's a good chance that we've actually helped to save their lives. If you've ever done any of that work or you've walked with someone through a crisis, you also have likely saved someone's life. To address firearms more specifically, the Department of Veterans Affairs entered into an important relationship, and I'm going to go through these next slides a little bit quicker so that my colleagues get enough time to share their important information, but we will share the slides with you. So the VA wanted to do more about firearm suicide prevention, and we wanted to be able to join folks who are already doing this important work. So as you see on the bottom of the screen, the American Foundation for Suicide Prevention and the trade association in the firearm industry, the National Shooting Sports Foundation, had forged an important partnership together where they were trying to educate people in the firearm industry about risk factors for suicide. However, it was not specifically focused on veterans. So we joined a partnership with those two organizations, respectively, in the last year and a half. And together, we have tried to increase our expertise and messaging so that we can encourage veterans and their loved ones to store firearms. The slide I showed you a few slides ago about how short suicidal crises are, that means that if somebody has more time and space between themselves and a firearm, there's a better chance that they'll survive that suicidal crisis. So storing firearms when they're not in use is something that the National Shooting Sports Foundation has been messaging to their large network of retailers and range owners, as well as enthusiasts who are members. And they helped us with the messaging that you see here. If you live in the state of Texas or one of the other states that we piloted our toolkit in communities, you may have seen billboards like these. We're testing out messaging. We would love feedback. Our goal here is never to take someone's firearm away from them or to disrespect the important rights that people have to access firearms. Our goal is to save lives. And we feel that the data that we have tells us a lot about what we can do. So just a last point about the relationship, we developed this toolkit. It's here in the slide deck for your use. It carries important messages about how to talk about firearms if that's something that you're not used to, or important stakeholders to engage. We're asking the governors and mayors challenge teams, which is a partnership between VA and SAMHSA, to motivate communities at the community level to do more to prevent suicide. And sharing the messages about the importance of placing time and space when someone we know, whether it's ourselves, our kids, our buddies, are going through a hard time. And I think I'll stop there. I so appreciate speaking with you, and I'm happy to answer any questions, but I'll turn it over to Dawn to cover an important intervention called suicide prevention safety planning.
Thanks, Aimee. Hi. You know, I think you heard Aimee talk a lot about how there's not one particular cause for a person attempting to take their life. And likewise, I think Aimee's talked a lot about how we just need to find the space and the time to give a person an opportunity to get through that suicidal crisis when they are experiencing it. And suicide prevention safety planning is one of those ways that we can do that. It's a collaborative effort that a provider and a veteran, or actually any person who's experienced suicidal crisis can come together and collaborate on creating this tool. It's to help de-escalate that crisis, identify the stressors or the circumstances which might have led to it in the first place, so that if that person is to experience it again, they'll recognize that they're in this place that's not very good. And so there's a written list of concrete coping strategies. We actually have a physical paper plan that a person can refer back to when they start experiencing the crisis or the symptomology that might lead to a crisis. It's not a suicide contract. We know that those are used or have been used through the years frequently with providers, but that we don't have any evidence that those are effective. Whereas safety planning is something that we actually have been able to recognize as being effective, and research is continuing to be done with that. It's a brief clinical intervention. A provider can actually take an entire session to use this as an intervention to create this safety plan for their veteran or their patient to take home with them. As you see, there's a hierarchical prioritized list of strategies, but what we tell people is if one strategy is not working, there's a list of steps. If one is not working, move on to another one. Don't sit there. And likewise, once the crisis is passed, you don't need to continue working with it. So we ask people to we ask the veterans to describe the last time they were in a crisis and feeling suicidal, and to think back and remember and recollect those things which might have been warning signs for them that there was a crisis about to start. We asked them to explain the suicidal feelings. What were the thoughts you were having at that time? What were the feelings you were experiencing? So that when that starts to happen again, they'll be able to recognize it and utilize their safety plan. Can you go on to the next slide, Aimee? Thanks. So here you see step one, the triggers, the risk factors, the warning signs, like we just discussed. We want to stress to people that, just like Aimee did, that the crisis will pass. We just need to take some time and create some space between whatever is happening to create the crisis, and allow for time for that crisis to pass. Thanks. So the first step in identifying ways that we can help with that are to identify coping strategies. And these are internal coping strategies, things that a person does not have to rely upon others or external factors for. We want them to be safe things, not things like going to a bar or a strip club or something like that, but things that might actually be helpful. Listening to music, meditating, doing yoga, doing something that is helpful to that person. It's very important that that person be able to identify what these things are, because they're the ones that are going to be using them, and they're going to know what's most helpful for them. So you want to endorse strategies, coping strategies that are positive and healthy, but things that they will actually receive benefit from. You want to also, at all steps during the safety planning process, you want to ask the person you're working with if there are any barriers to their using the safety plan or any barriers to the different steps that they're identifying in their safety plan. And you want to be able to work through that process with them. And let me add also, a safety plan does not necessarily have to be done by a provider. Sure, we would like that to happen, but if you have somebody that's close to you that's experiencing a crisis, a safety plan is something that you can try and work with them on until they can get to their provider. And at any point in the process, you want them to be able to reach out for additional help from a professional if needed, or a crisis line. The third step in the safety planning process is to identify social contacts and social places or events that might act as a distraction. One of the things that I've noticed when completing safety plans with people is they immediately think that the social contacts piece has to be people that they can share their crisis with or share their concerns with, and sometimes that's a hindrance because they don't want to share these things. I like to redirect them and tell them that for this particular step, the social contacts are just people that can distract them from the crisis and help them buy that time that we know can be helpful in allowing that crisis to pass. We also want to identify places like parks or maybe a coffee shop or some place that's just going to add, like I said before, a distraction and buy some time. The fourth step is to identify actually those people who they might be able to share things with. Tell them what's going on, what I'm feeling, what I'm thinking, and this is where these thoughts or feelings have led me in the past, and I'm concerned. Can you help get me through this? So we want people to identify family members or friends or people that they can trust, not necessarily professionals, because that will come in a further step down the road. We want them to also put on their safety plan actual phone numbers for these people. In the past, I've seen safety plans where instead of having a phone number, it'll say stored in phone or something like that, because of course we all have these phones now that some of us can just talk to them and say, hey, call mom or call so-and-so. The problem comes when we might not be able to access that information from our phone. Maybe it's low on battery and we can text. So we actually want them to have a plan, or maybe they don't have their phone. We want them to have that phone number written down on that paper. So the fifth step in the safety planning is the professionals, agencies that might be helpful. All of the safety plans that I've used have the crisis line information already put on there. We add things like who the provider is that the person might be working with, or providers. Perhaps it's an emergency department, the closest one to them, or perhaps the VA emergency department. When I'm completing the plan, since I'm part of the suicide prevention team, I like to add the team voicemail and just as many contacts as possible, because the key is, again, to buy time and to help provide distractions from the crisis and help that person get through this crucial point in time. Always you're going to have 911 for emergencies or the crisis line. And step 6 is also a crucial point. We want to make the environment safe. So we're going to ask the person things like, what means do you have available to you if you were going to hurt yourself? How can we buy time and put distance between you and those means? We're going to want to know in the last suicide crisis or in the planning stages what kinds of things they considered using as means. And for instance, say it is a firearm and they keep their firearm locked up and they have a gun lock, those are readily accessible for people. That helps buy time. We want to maybe ask them if they thought about putting their safety plan by their gun safe, or if they thought about an overdose or have done that in the past, perhaps in the medicine cabinet or where they're keeping that. What can you do? Can we get, they have medication dispensers now available where it's only going to provide you with the medication that you need, or perhaps a person can help you. What are the things that can make your environment safe? And exploring that with a person who has been in a suicidal crisis before can be extremely helpful. So if you want to look at the next slide, we'll talk about what are the things that you can do to keep your environment safe, and where might you put your safety plan that might be helpful with that. Who are the people you can share your safety plan with? Who are the people that your providers can reach out to if you're in a crisis? Again, it's about buying that space and that time and providing a distraction to allow for the crisis to pass. Suicidality is not a constant state. It's something that people can come in and out of depending on what their circumstances and situations happen to be at that time. So we talked about gun safety, opioids, what those medication drop boxes where they drop the medication that you need only as you need it. Oftentimes people that have access to opioids might also have a prescription for naloxone or something that can pull them out of an opioid overdose crisis, buy them some time to get to the emergency department. Disposing of excess medications, we want to make sure that people who might have a tendency to overdose. I think Aimee mentioned how females that are not veterans might have a tendency to use this method for suicide. We want to make sure that they just have enough access to what they might need, and if they don't need it, don't have it around. Can you move to the next slide, Aimee? Thanks. So here's where you come in. Talk with people that you know are caring for veterans or veterans themselves about ways to keep their environment safe, ways to keep themselves safe. These safety plans are readily accessible on the internet. You can look for them and find them. SAMHSA is very involved with safety planning as well. I found several, before coming to the VA, I had found several safety plans on the SAMHSA website. So at any point in time, you have a person who might be in crisis, please don't hesitate to develop a safety plan with them. Talk to them about the things that might be helpful to them. Stress to them that there's a crisis line available 24/7. You can always call 911, go to an emergency department, talk to your provider. But safety planning can be a very effective intervention in buying that space and time that a person may need to get through that suicidal crisis, and keeping the means to carry out a plan at a minimum. Keeping those means from them is very important. And I really appreciate everyone that's online taking the time to hear what we have to say. We want to keep everyone safe. Thank you.
Thank you, Aimee Johnson and Don Schiro. A lot of great information that you have provided us. And one of the things that I really love about it is the fact that it not only gives us an idea of what the landscape looks like when it comes to suicide, but it also helps us to understand what a person is going through, the different emotions. And one of the big things that I took out of your presentation is that it doesn't have to be a lifelong thing. You know, it can be an emotion that you feel today, and tomorrow you may be fine. But you may come back to feeling suicidal, and you may have these thoughts, but you know, you gave us great insight on how to be an advocate to prevent, or at least buy time, and maybe that feeling can pass, and you know, we can bring in professional help or things of that nature. So Aimee, Don, thank you so much. And to bring our Suicide Prevention Summit home, Dr. True and Matt will present as a team. So at this point in the summit, I will turn it over to Dr. True and Matt. Thank you both.
Great, thank you so much. Can you see our slides okay?
Yes, they are perfect.
Great, okay, great. Thank you so much to Larry for having us on the panel today, and to Aimee and Don. It's wonderful to follow you. It feels like our presentation fits in right after yours. So thank you to everyone for attending as well. So Matt and I are going to speak to you all today about a coalition that we have locally here, starting in Southeast Louisiana, but we're planning to spread out to the rest of the state, This is a coalition of VA researchers, healthcare providers, mental health providers, veterans, service members, and gun store owners and gun show vendors, and concerned family members and anyone who's an ally to veterans in our state and in our region. So this coalition is called the Veteran Informed Safety Intervention and Outreach Network. And we started with funding from the Department of Veterans Affairs from Health Services Research. So we just want to acknowledge that funding, and we're grateful for that funding.
Good morning, everybody. I'm Matt. I'm originally from Gina, Louisiana, which is a small town north of Alexandria. I joined the Louisiana Army National Guard back in 1998 when I was a junior in high school, and served 6 years as a truck driver in a transportation company, and then a drummer in the 156th Army Band out of Bossier City. On the veterans side, I've been involved from serving as a military and veterans aide to U.S. Senator Mary Landrieu, to more recently being a volunteer leader for Team Red, White, and Blue, a gray shirt for Team Rubicon, and part of the Service Leadership Corps with the Mission Continues. I'm really proud to be part of this diverse and really committed team of people that are on this project. Everybody is just really passionate about preventing suicide among veterans and service members and supporting families. And most of us in this group have been touched in some way by this topic personally. The team includes 4 veteran champions like myself. We bring a diversity of experiences and perspectives to these conversations, which I think have been extremely important in grounding the work in real world, real life experiences, and acknowledging that there is not one veteran experience. You know, there really is a diversity of different experiences within the veteran community. The veteran champions have also been helpful in making sure that this project stays connected with the community, and we've all been, you know, helpful in bringing all sorts of different community stakeholders to the table. We're also really happy and really fortunate to have a really engaged board, advisory board that meets bi-monthly. As you can see, this group also has local and national experts in lethal means research and suicide prevention, and also includes a number of former service members, regional leaders in our veteran and military communities, the family caregiver of a combat veteran, and an advocate who lost a loved one to a firearm.
Thanks. So we can really follow on to, I think, Aimee and Don's presentations, and say that just despite, you know, our recognition that there are widespread efforts and attention to the problem of suicide among veterans and service members, but rates of suicide by firearm among veterans and service members remain unacceptably high. And while this is a national issue, it also feels deeply personal and local here in our state, where rates of veteran service member suicides involving a firearm are closer to 85%, so it's even higher than the national average. In fact, of the veterans who were patients at the VA here in New Orleans over the past 3 years or so, almost every completed suicide has involved a firearm. And I think Aimee's presentation really described very well why that is, because veterans and service members can be very comfortable around firearms, feel very familiar with them, and often have them at hand. But it is the most lethal means of committing a suicide. And as Aimee pointed out so well, the person usually doesn't have another chance to get help, get through that moment of crisis, that day of crisis, and move forward into healing. So we really wanted to focus on firearm safety and creating time and distance between a person and their firearm, especially when they're in a mental health crisis. We also note that rates of suicide by firearm are even higher in rural areas. And while we have some big cities here in New Orleans, we also have some highly rural communities, you know, surrounding those big cities. And we know that many of those veterans are not enrolled in VA care, or they interact with the VA only infrequently, because rates of use of the VA in rural areas are lower than in urban areas. So that's part of why we're so focused on firearms in our community. So I'm just going to talk a little bit about the project, and then we'll dive into kind of talking to you about what we've been doing and where we are moving forward. So we know that an essential element of preventing suicide by firearm is to create time and distance between the person who's experiencing suicidal thoughts and a loaded firearm. So for example, as Aimee and Don brought up, if a person is willing to temporarily store their firearm outside the home until the crisis has passed, or if we can increase the uptake of safer storage practices inside the home through the use of locked storage devices or storing ammunition separately from firearms, we know that we have a chance to help that person get connected with care and social support and get through that crisis. But there are a number of barriers to implementing some of these great best practices that Aimee and Don have talked about already. And some of those include things like mistrust of the message and the messenger. And so that's something that we really need to be able to address, some of those barriers to those best practices and those interventions. So our project takes a public health approach to addressing these barriers with an emphasis on mobilizing community partnerships to inform, educate, and empower veterans, service members, their families, and other stakeholders such as gun store owners, gun show vendors. So we were awarded 18 months of initial funding to build capacity within our region and establish feasibility of our approach. So we right now are covering Southeast Louisiana, the region that's circled there, but we do hope to spread what we're doing to the rest of the state and beyond. So with this phase 1 funding, we identified 4 veteran peer champions, as Matt talked about, who have personal experiences with the issue, and they have been informing project activities since the beginning, helping us to connect with a wide range of community stakeholders. We've been engaging with these key stakeholders in our community through community meetings and something called deliberative discussion forums, which I'll just say town halls for short, with the ultimate goal of developing and piloting interventions in a toolkit that can be tested out more widely in our community. So I'm going to take a quick second to talk about deliberative discussion forums because it's a key part, along with the veteran peer champions, it's a key part of what we've been doing. So it's a method of community engagement and dialogue. And the reason that we decided to use this method is because it's a structured way to elicit public input on an issue where you expect that people will be coming from a range of viewpoints and backgrounds and experiences. So your goal is to reach some level of consensus or common ground with people who are coming from different perspectives and to be able to figure out how to move forward with solutions together. So we wanted to bring together people in our community who care about and have a stake in preventing suicide by firearm, while recognizing that they come to the discussion with a wide range of sometimes opposing views and perspectives. So you might have people who are Second Amendment advocates, you might have people who are firearm safety advocates, you may have mental health providers who own firearms or do not own firearms, and you may have family survivors who have survived the suicide of a loved one. And they may all be coming at this issue from different perspectives, but if you get together and talk about it through this structured method, you can do things like build trust and rapport within the community and between these different stakeholders, and also between members of the research team, because this is a research project, and members of the community. You can identify common goals and language and create buy-in around how are you going to collaborate on an intervention. And then finally, you can begin to early on proactively address barriers and identify existing strengths in your community and resources in your community that you can build on. So that's why we chose this method, and we just wanted to kind of give you that background.
So you can see on this slide the rough outline of how we've gone about this work over the past almost a year. We are 1 year into the initial 18 months of funding. We've been identifying community stakeholders, like Gayla mentioned, meeting with them, having conversations, asking them to attend town hall, or otherwise commit to joining the coalition. We're in the process now of analyzing the findings that that have come up along the way, sharing those with our advisory board and community partners, and just getting more input and more feedback. We're moving towards refining what intervention or various interventions might look like, and then figuring out ways to actually pilot those. And these are informed both by the best practices in interventions, but also the real world experiences of the veterans from Southeast Louisiana, both those of us on the Veteran Champion Group, and also all the veterans that we've connected with across the region. In terms of coalition building, the engagement has really been aimed at connecting in a meaningful way with as many stakeholders as possible. So members of our team have attended gun shows and talked with vendors, have spent time at gun shops talking to owners and customers, met with leaders of multiple veteran service organizations across the region, spoken with members of gun clubs and gun ranges, consulted with local government and law enforcement who also work with suicide prevention and misuse of firearms. We've also engaged frontline mental health providers and pulled in that angle as well, including suicide prevention coordinators at the VA, at vet centers, and at military bases in the area. The great thing about this process, especially from the veteran perspective, is that it didn't start with any assumptions in mind, right? It didn't start by saying, should we do this or should we do that? But it really, the main purpose of the meetings that we've had has been to listen and learn, to just give veterans and other stakeholders just kind of an open forum to bring their experiences to the table and talk about the unique perspectives that they have. What people see as challenges to implementing the interventions, the specific interventions aimed at preventing suicide by firearm, what people see as available resources and assets in the community, and then just brainstorming about what acceptable messaging and interventions might look like, because we all know these are difficult conversations to have, and especially difficult when you're talking specifically about the prevalence of firearms in veteran suicide. And mainly, you know, this process has had the goal of building trust, which, you know, is sometimes lacking when they hear that we want to talk about suicide, especially suicide by firearm, when they hear that we're from the VA or there's a connection with the VA. So we believe that building trust lays down the foundation to have authentic and open and collaborative discussions that'll move us toward finding effective solutions. And so once that connection of trust is there, we can leverage the power and perspective of every stakeholder and ask them to help us identify additional partners and continue to grow the community. With, you can see on this slide kind of the breakdown of how our town hall discussions have gone. Obviously, this has become very different with COVID-19 challenges. Initially, we intended to have a number of in-person town halls, and most of this has become virtual. But we've been successful in connecting with leaders of different communities. Again, veteran service organization leaders, gun store owners, and people who are at the intersection of those two things. It has been more challenging to connect with individual firearm owners because of COVID and those sorts of things. But as you can see on this map, you know, we've connected across the region to a decent extent. Again, you know, the coronavirus and the kind of the shutdown of everything has made it difficult to get further out and connect with more rural veterans. And, you know, obviously we're all very distracted and there's a lot of stressors that normally aren't here. So, but we have kind of made that effort to go out and connect across the region outside of the cities as much as we can.
So now I'm going to talk a little bit about what we've learned so far and what we see as the 3 pillars of our toolkit, and you'll see a lot of echoes of what Aimee and Don have presented on before. But I just wanted to talk about kind of what we learned locally, because I think every community, every region of the country is a little bit different. So first, we learned a lot about what messaging would look like. We're really interested, one of our goals, overall arching goals for this project, is to try to think about having universal conversations about safe firearm storage, whether it's outside the home or inside the home. And one of the reasons for that is, if you think about it, one of the metaphors that's kind of come out in a lot of these conversations is about safe firearm storage being something more like wearing your seatbelt. So rather than it being something that you have to sort of try to guess when someone's at risk for something and put that into place at the moment that they're at highest risk, that really we should be having universal conversations in our families, in our communities, in our gun stores, you know, in our friend groups, we should be having universal conversations about safe firearm storage and about suicide risk, and that, you know, that's kind of one of the things that has come out of this. We've also really heard a lot and learned a lot from people about the need to tailor messaging for different audiences. So we need to be able to take into account things like, why does a person own their firearm? If it's primarily for home defense, then they may have different concerns about safe firearm storage that you need to make sure to address and brainstorm solutions to those concerns. So we learned a lot about how important it is to match the messaging about safe firearm storage and suicide prevention to a goal that is acceptable to the person. And I think that that resonates a lot with Dawn's presentation about safety planning. But even what we learned was that, you know, even if you go to specific organizations that we plan to partner with, they're gonna have different memberships, and within their membership, there's gonna be some individual diversity, but even across all these different organizations that we're working with, there's some diversity in terms of the membership of these organizations, in terms of why they own a firearm, how they feel about their firearm, how they feel about some of these different options for safer firearm storage and creating time and distance, and that you really need to be able to kind of tweak your message constantly you know, in recognition of the people that you're working with. We heard from people that there was a lot of openness to receiving assistance and guidance from people in the VA or other academic or research or clinical settings, but there's a real emphasis on how the messaging and the delivery of the intervention should go from veteran to veteran or service member to service member. So even though someone like, you know, me and other members of our team, we may be able to help a lot in identifying resources, in getting them out there and assisting people in crafting the message and getting the message out there. But really, it's going to need to be people like our veteran peer champions and other firearm owners and veterans who we've partnered with, who are going to need to be delivering the message in order for the message to be most trusted and understood. And then there's a mutual recognition for all of us that engagement, this kind of community engagement that we're doing, requires a lot of trust and time and sustained effort. So we're very committed to building that trust and to remaining engaged in this work, and we recognize the effort that that's going to take, and we're ready for it. Around out-of-home storage, so we learned a lot about how this is kind of a universally well-received concept because of people's time in service. They're used to being told how to store their weapon, how to clean it, you know, where to keep it and things like that when they're on base. But there also is some stigma and concerns that need to be addressed. There's a little bit of stigma around the idea that you might not feel safe around your own firearm, and that you might need to temporarily store it outside of your home, outside of your reach. There's some concern about how that feels and what that looks like, and that needs to be addressed. We also heard from a lot of veterans and service members who say they've already done this informally, or have a plan with a trusted family member or friend, that if they're in some sort of crisis, it feels very acceptable to temporarily and voluntarily give their firearms to someone else to hold on to for them until they're feeling better. And then we also heard a lot about an emphasis on this being a time-limited or time-specific approach. So a lot of veterans and service members are very aware of the fact that they have maybe anniversaries during the year when they may be feeling more stressed or challenged by memories of losing someone or something that happened during their service or on deployment, and that those may be specific times of the year when they might want to take advantage of something like temporarily storing their firearm outside their home. And then in terms of in-home storage, we heard a lot about this idea that we need to address the goal of why someone has their firearm, and if they have it primarily for home defense, that they're always going to have one firearm that they want to keep at the ready for home defense, and it's going to be challenging to get them to think about storing that firearm separate from ammunition or locked in a cabinet, and that's something that we're really going to have to work on to talk about. What are some ways to brainstorm ideas about that with people who primarily have a firearm for home defense and want to keep it at the ready for that? We heard from many people who said that cable and trigger locks, they recognize these as being easier to implement and kind of less expensive and are given out frequently, but also they were seen as less effective for different reasons. Sometimes people said they just plain didn't like them, didn't use them. They might accept one for free, but then not use it. And there was a lot of talk about how higher end storage options, such as gun cabinets with biometric locking systems, were more desirable, but also more expensive, a little bit more inaccessible, and that we needed to figure out ways to make some of those higher end options more accessible to all people in our community. So we have been working, in addition to working in our local community, we've also been working with and talking with and consulting with a lot of different teams across the country. For example, Aimee Johnson is on our advisory board, and you know, we've definitely looked at a lot of the resources that are available in the toolkit that came out of the Office of Mental Health and Suicide Prevention. We've really had a lot of productive phone calls, meetings, and consultation with all of these partners to be able to see what resources are already available so that we don't have to reinvent the wheel or try to create something when there are already so many good resources out there. And we have some really good and fruitful and supportive experiences with a lot of these organizations who've said, you know, we want to get our resources out there. You can please feel free to use our resources, adapt them locally for your region or your messaging, and please go ahead and use them. So what we're gonna do in the rest of this time, kind of quickly, is share with you just some of what we think are probably some of the really great resources that are out there. We can't touch on all of them, but one of our next steps, we've been pulling all of them together and we'll make them available in our community. So quickly, I'll just talk about some best practices and resources available around messaging. Even though we did hear quite a bit that messaging is kind of more acceptable from veteran to veteran or service member to service member, we did hear a lot about also just trusted people in one's community. So that could be a trusted healthcare provider, a trusted person who owns a gun store that you go to and things like that. And so there's a great resource on talking about safety messaging for clinical staff. It's a pocket card, but I think all of the tips on there which are available really could be useful for anyone who wants to talk to a friend or loved one or family member about this. There's also a great pamphlet about starting the conversation. Project Child Safe has a lot of really wonderful resources that are available in the toolkit that Aimee mentioned. And then there are different coalitions like the New Hampshire Firearm Safety Coalition that have made posters for firearm retailers, and we are adapting those for our local community, and we'll make those available as part of our toolkit. They've given us the go-ahead to adapt those. For out-of-home storage, there are a lot of really incredible efforts throughout the country. We've just highlighted a few here to create a gun storage map. So that is to have an interactive map of gun retailers, gun stores who are licensed to store firearms for someone and who are willing to store a firearm for low cost or free for someone who wants to store that firearm outside their home for various reasons, including concerns about their own safety and mental health. So I'll talk a little bit more about some of our next steps, but we've been consulting with all these different groups and getting together with them and learning from them. And we have some of their resources here available for you, but that's something that we'll be doing in our community going forward in the coming months. In terms of in-home storage, again, there are some really wonderful pamphlets available, kind of one-pagers. There's a great infographic from Project Child Safe on storing your firearm safely in your vehicle. And actually, we made our own infographic, which we can make available to you about this because the rules are a little bit different in Louisiana. So we made an infographic specific to Louisiana about safe firearm storage in your vehicle, which you know, is important in terms of making sure that that your firearm is stored safely and can't be used by someone in your family or stolen from your vehicle and misused in some way. So our next steps, we have been spending all this time consulting with these other groups, scouring the internet and making calls and finding all of the best existing resources that are out there. We're putting them together to create a toolkit, kind of like a menu of information and tools that people in our community can use. And we see this as being something that people can pick from depending on what they think would be the best thing to share with their membership if they're the head of a veteran service organization or a nonprofit that serves veterans. And so we've been pulling all these together. We'll be making them available to people and also working with individuals and groups to see, how can we help people implement these resources in their organization. We're also starting to work on creating a map of participating locations in our region and eventually our state of gun stores, gun retailers who are willing to provide temporary voluntary out-of-home firearm storage in our community. And we know that there will be some barriers to entry to being able to do that. And so one of the things that we're committed to doing is understanding what those barriers are and then finding ways to address them. So if it's that the store doesn't have enough storage cabinet space to provide that level of storage, then we'd like to be able to get an additional cabinet for them if they're willing to commit to storing a firearm for a veteran or service member who needs it, free or at low cost. We're also collaborating with all of the organizations who have joined our coalition so far, and hopefully, if you're out there and you're interested, you'll be the next one to join, to work with organizations and individuals to disseminate information, all the resources we pulled together, and this interactive map that we're creating, and to hold events and activities where we can disseminate this information. One of the things that we heard in messaging that I didn't mention before is how important it is to create events or give out this information in ways that don't feel like they're overly focused on mental health or on firearm safety, but that feel like they're kind of universally, drawing on the camaraderie of veterans and service members and firearm owners who want to get together around other topics, but where this messaging can really make high impact if it's put together with some of these other events. And then finally, we're continuing our coalition and capacity building in our community to develop kind of the next step of this, which would be kind of a larger intervention where we can also be measuring outcomes. And we've been working on other people across the country to look at what are some ways to measure whether or not this messaging and these options are working. How can we tweak them and make them better? And are they having the effect that we're all looking for? So how can you help? I'll start off and then hand it over to Matt to finish this off. So we would really love for you to visit our website. The address is up in the slides. The slides will be available. We're going to also provide it our personal contact information so you can get in touch with us. But please visit our website or reach out to me or Matt to find out more, to join our coalition, to help us identify additional organizations and individuals. In particular, we're looking for things like gun stores and gun ranges that you might frequent where you have some level of trust with the owners or people who run the range who might be willing, you might be willing to help us connect with them and have them join our coalition. Any veteran service organizations, any nonprofits that serve veterans. We're also particularly interested in any organizations that serve rural veterans because as we said earlier, that's been more challenging to connect with those individual firearm owners and families in rural areas because of COVID-19. So please, visit us, reach out to us, and we'll get back to you, answer your questions and concerns. And we'd love to have you join our coalition to serve our community. And I'll hand it over to Matt.
Yeah, this continues to be a naturally evolving process. It's been really great to see so many different people, organizations, veterans come together and have just great conversations about, what can we do? What are creative solutions to reduce suicides? And so we would love for you to sign up just join our mailing list. We're not going to send a ton of emails for sure, but we want to keep everyone updated as we go through the process, as we identify potential strategies, as we work to implement some of these strategies. And, there's a great chance that we'll reach out to you and ask for your feedback and your ideas as well. So we really appreciate, everyone's interest in this project, and would love to have you be part of the coalition.
And that's it for us. I think our contact information is up on this final slide. The slides will be available. We have a website, and I think all the panelists are going to stay and answer your questions or take any comments. And I'll just say that even if you don't have a question, I think all of us would really love to hear from you about any challenges that you think are you're facing in terms of having these conversations around all of the things we've talked about today. Any challenges that you think we're facing locally or nationally, but also any resources that you think are available in our communities that maybe we haven't already mentioned today. I think everyone on the panel would love to hear about that from you. So even if you don't have a question, please, put your comments, your resources, your challenges in the Q&A box, because we really want to hear from you.
Gayla, Matt, thank you so much. Aimee, Don, you just don't know how good it makes me feel to, first of all, have the opportunity to connect with each and every one of you. And as we were planning this summit, we had a lot of conversations about content and presentation. What did we want to focus on? And I can't thank you all enough for the hard work that you do. Getting to know you all, it has been a pleasure. And I would encourage anybody as the questions start coming in, and we will definitely get to your questions. I would encourage anybody, once I send you not only a recording of this summit, but I will also send you the slideshow, do some research on the presenters, because they are involved in a lot of things. And Dr. True, I can tell you, I wouldn't want to walk in your shoes. It's a lot of things that you do, but also Matt, Don, and Aimee, awesome work that you do. And again, I would encourage everybody to check out the Vision Project. Know you, I'm a part of the coalition. It was one of the best things that I've done. And if you are serious about suicide prevention, please have a look at it. With that being said, before we get into the questions, I want to let the audience know I really appreciate your attendance, because it shows that you are serious about suicide prevention. And thank you all for attending this year's summit. And we'll go ahead and we'll start with the Q&A. No, there are not any CEUs for this summit. However, after this powerhouse presentation and information, next year I will definitely be looking for approval for CEUs, but a participation certificate, I can verify that you participated if you email me. And as a matter of fact, I'll go ahead and record your name. And that was from, that question's been answered. But yeah, I have your name. And if you send me an email, larry.williams@la.gov, if you need verification that you were attending the summit. I have a list of everyone who attended. And I think, was that the congratulations? Mr. McGee, please, I will send you the PowerPoints and the information from this summit. And we'll hang out for a few minutes if no other questions come in. Like Dr. True said, please post your own resources that you may have. You can post them in the Q&A, and we'll go ahead and get it answered for others to see as well. And thank you all for congratulations.
Larry, I was just going to say, it looked like great attendance. I saw something like 90 people, or I don't know, at some point 88 people or something like that, which seems really encouraging.
Yes, Dr. True, it was a very good turnout. Okay, so I see a lot of interest for the slides. Again, everyone who registered, I have your email address. I will send you a copy of the slides from the presenters. Also, you will get a copy of the recording so that you can play back. And I ask that you share this information with anyone who you think could use it. This will also be uploaded to the Louisiana Department of Veterans Affairs YouTube page as well. Gayla, Matt, Don, Aimee, thank you so much. I really appreciate it. And I'm quite sure that we'll be in contact soon. Thank you all for attending. Thank you all for attending this year's summit, and enjoy the rest of your day and enjoy your weekend. Thank you.
Thank you.
Thanks so much.